Hello, I'm Anina from Neethus Academy. Today in this video, we are diving into a crucial aspect of OET speaking subtest, that is, showing empathy effectively. Whether you are a nurse, a doctor or any healthcare professional, demonstrating empathy is a key factor in order to build trust with the patient and thereby achieve a high score in the OET speaking module. This whole section I have divided it into 4. Then moving on with the first section, understanding empathy in OET speaking. This particular section I have again subdivided into 2. The first is, what is empathy? Empathy is the ability to recognize, understand and respond to the emotional state of a patient. It includes we have to acknowledge the patient's feelings even when they are not clearly expressed. That is, this shows we are not only just caring about their illness, but their emotional and psychological well-being is taken care of too. In the OET speaking subtest, this empathy is being expressed under the criterion relationship building. As I have mentioned it earlier, this is not just about understanding the patient's feeling, but also how you are expressing this understanding properly. Second is benefits of showing empathy. First, it builds trust and cooperation. Second, it makes it easier to gather accurate information from the patient. Third, it reduces patient anxiety, which will thereby improve the communication flow. The fourth is, it will help the examiner to see that you are safe, professional and patient-centered. Next, section 2, empathetic phrases that we can use. I'll show you some empathetic phrase which you can use effectively. I can see that you are upset. It sounds like this has been a stressful time for you. That must be challenging for you. I am here to help you through this. Let's work together to find a solution. It seems to me that this has been a big worry for you. I'm sorry about that. It sounds to me that it has been a stressful time for you. So these are some of the phrases, empathetic phrases that you can use while you are doing the role play. The most important thing is, while using these phrases, you should be sincere and you have to use all these phrases appropriately according to the context of your conversation. Now, section 3, demonstrating empathy in role play. Let's look into a sample role play scenario. Patient: I am really worried about my upcoming surgery. Healthcare professional: I understand that you are feeling anxious about the surgery. It's completely natural to have concerns. Let's discuss the procedure in detail to address any questions you might have. In this given scenario, the professional acknowledges the patient's feeling and offers support, thereby demonstrate the empathy effectively. Now, moving on with the last section, that is common mistakes that we have to avoid. The first one is overusing generic phrases. Repeating lines like, I understand how you feel. It is too robotic or insincere. So what you have to do is, you have to tailor your response according to the patient's situation. For example, instead of saying, I understand how you feel, instead you can say like, it is understandable that you are nervous about starting a new medication. Second, sounding emotionally detached. So here, a flat tone or a rushed delivery can even cancel out the best empathetic phrases. So you have to remember, how you are saying is just as important as what you say. So for that, you have to use a calm, warm and a reassuring phrase or tone in order to match with the particular emotion of that patient. Third point is interrupting or rushing the patient. So here, cutting off a patient who is expressing their emotions lack active listening. What you have to do is, let the patient finish first and then pause before proceeding and then reflect on the concerns first. Fourth point, making assumptions about the patient's feelings. Here, you have to avoid phrases like, I know exactly how you feel, you must be terrified. See, you can never truly know unless a patient tells you. So instead, what you have to say is, you seems worried or you seems terrified. Would you like to share more about what's on your mind? Fifth point is using inappropriate humor or dismissiveness. Here, avoid making jokes or minimizing the situation, especially when the patient is distressed. For example, you don't have to say like, oh, it's not a big deal, everyone gets scared. Instead, say like, it's perfectly normal to feel that way and I am here to guide you through it. Sixth point is being too formal or clinical. Here, using highly technical terms when a patient is emotional will come off as cold or impersonal. For example, if you are saying the dosage adjustment is a standard protocol, they won't understand what it is. So instead you have to say like, we are making a small change in order to help you feel better and in order to reduce the side effects if there is any. The seventh one is giving reassurance without any explanation. Simply saying don't worry or you will be fine doesn't feel like reassuring if it is not used along with some fact or clarity. For example, we can say like, I understand your concern about this scan. I have to reassure you that this is a painless procedure and we will be closely monitoring you. Eighth one, failing to adjust your language according to the patient's age group and background. Here, using the same empathetic tone or vocabulary for a child or a teenager or an elderly patient, it doesn't seem to work equally. So what you have to do is you have to use your empathetic language according to the listener. For example, for children, you can say like, I can understand that you are a little bit scared. Would it help if I stay with you? For elderly patient, you can say like, I understand this must be overwhelming for you. Let me explain everything step by step. The last point is memorizing empathy instead of practicing it. Here, the practiced empathy comes from active listening and how you are naturally using these empathetic phrases according to the situation. So here, what you have to keep it in mind is don't just memorize these phrases. Instead, you have to practice the role play. And then you have to learn how to use all these empathetic phrases meaningfully according to the different scenarios. Finally, I need you to remember one thing, that is demonstrating empathy according to the situations. It is not just for passing OET speaking module, but instead this demonstrating empathy will help you to connect with the patient, thereby you can give more compassionate care to them. Which means not only this particular section is helping you in the OET speaking subtest in order to score more in that particular area, but instead it will help you in the real life healthcare scenarios. Thank you.